Please tell us who you are, what problem your company is solving, and where you see your company growing to fit the changing needs in this space.
Novorol, co-founder and chief medical officer at Ada Health. Ada is a symptom assessment, triage and care navigation platform, and it helps people navigate to the right care first time, and also reduces the time to correct diagnosis and treatment for underdiagnosed and undertreated conditions. And the problem we're addressing really is that we all get sick, we all get symptoms, and when we do, we have to self-triage, and we have to decide what to do about those symptoms, whether we need to seek care, and if so, what type of care and how urgent is that care. And that's not always easy for people to get right. So obviously a lot of people end up at the ER when they don't need to be there, or scheduling with the wrong clinician, or potentially sitting on worrying symptoms until things get much worse. And for some conditions, especially rare conditions, it can actually be years on average for people to get to a correct diagnosis. So there's really a need to help people self-assess accurately and navigate to the right care first time, avoid unnecessary care and costs, of course, but also unnecessary delays in getting to the right care and the right diagnosis and the right treatment. And that's where Ada comes in. Ada's platform helps people self-assess, self-triage, and navigate to that right care first time, whether it's primary care, urgent care, emergency care, or specialist care, or of course, self-care at home. And to get to a correct diagnosis and treatment sooner.
Clarify, are you selling to providers? And if so, how are you penetrating that today, where it's just seemingly gotten very challenging to sell into providers?
Yeah, so we have a consumer platform, mobile app and web products, and we have a sort of free assessment and navigation offering for consumers, but we also sell that solution into large health systems, payers, providers. And so we're navigating the patient from that sort of first, I guess it's the digital front door, we navigate them into the system and to the right care option within the system. And we also work with life sciences, and that's about accelerating that path to diagnosis and treatment. I mean, it is obviously a long sales cycle. It takes time. These are big partnerships and big sales, but basically, we have something rather unique, which is the kind of breadth of condition coverage, the depth of the assessment, the accuracy, and that ability to really navigate in a very nuanced and sophisticated way to the right care options, including specialist care. So that's really what differentiates us, and that's something that many providers and systems have told us they tried to build something themselves, and it's just sort of something that's not possible to do without that sort of sophisticated tech that we've built. So we have a really unique ability to navigate in that very sophisticated way.
But what's been the most challenging aspect of getting to where you are today, and how did you overcome that?
What I guess has been most challenging for us, or was very challenging at first, is that we launched our assessment direct to the consumer back in 2016, and we'd built this incredible assessment covering thousands of conditions. We're getting amazing feedback from users about Ada helping them identify something that they hadn't had a diagnosis for years, and getting to a diagnosis after all that time, or saving their life by flagging something like a pulmonary embolus or appendicitis, for example. But everything we tried a number of ways to monetize direct to consumer, and that wasn't working at first. And in the meantime, we had so much inbound interest from big enterprises, from payers, from providers, from life sciences, wanting to integrate our assessment and our kind of navigation capabilities, either to integrate them into their system or basically to sort of leverage them. And so we had to make that flip basically and find a way to monetize that way, and then build out the enterprise integrations, which is something obviously quite different to a mobile app. And we have done that successfully, but that has taken a number of years to really sort of build up. So the consumers were using this product, telling us how great it was, but then we basically had all the demand from the enterprise side, and had to build a business model around that.